recording this as well so that you'll be able to review if you need to. The Oregon Dental Assistant Association is excited about this year, 2025. We have lots of new things that are coming up. And one of them is that we want you to visit our website, where we have all kinds of different information on there, including CE courses that are available. We have a video that we collaborated with ADEC to talk about the importance of four-handed dentistry and dental assisting. We have recruitment information, postcards, we have posters, all kinds of things to help with recruitment. So for those of you that know people that might be interested in being a dental assistant or interested in the pathways, the education, and the financial support that's available, you can go to our website to find that. And then the Oregon Dental Conference is coming up in April. We have 3 courses that have been scheduled for that, and all of that information will be on our website. We have business meetings every other month, and we'd love to connect with all of you, no matter whether you're a member of the Oregon Dental Assistant Association or not. We invite you to come, and if you're interested, again, contact us through our website. We have connection to Facebook, Instagram. Now we have LinkedIn, and also we have a YouTube channel that we're working on so that we can communicate with dental assistants all over the state. We have a wonderful featured student program that honors and recognizes dental assistants. Students that are in programs right now or have just recently graduated, their stories are great. So if you have a chance, go and read about those. And then we also have a area where you can post jobs and look for jobs yourself, but also if your office is looking for new dental assistants, has job openings, you can certainly go there as well. So we just would love to have you join us and connect. And without further ado, I'm going to introduce our speaker for this evening, Monica Emmons. She is the Senior Region Specialist, Chairside Solutions for Dentsply Sirona. Monica attended Portland Community College, Eastern Washington University, and King's College London in the UK. Monica's focus is to provide professionals with current concepts, technology, and evidence-based research to assist in implementing effective and efficient evidence-based treatment protocols for clinical practice. Monica has more than 35 years clinical experience in both periodontal and general practices and 20 years dental hygiene education. Monica was clinical educator for Dentsply Sirona for over 6 years and served as an adjunct faculty member at Portland Community College Dental Hygiene Program. We welcome Monica. Thank you so much for being here.
Thank you very much. Yeah, so we're going to talk about polishing this evening, and thank you all for attending. So what we want to do is we want to provide a better patient experience and also clinician experience. So a lot of the information I present tonight is focused also on providing a better experience for you as a dental professional. Oh, how do I advance my slide? Here we go. Okay, so when we talk about polishing, we want to think about a few things, like, of course, the protection for ourselves and for our patients. We're going to look at infection prevention. I'm going to talk about the technology, and then at the end, we're also going to talk about maintenance of our equipment for polishing. So when we are polishing a patient's teeth, the criteria that we look at is biofilm, of course, because biofilm drives disease for a patient. So removing that biofilm is critical. The presence of stain, and this is what patients are looking for. They like that nice, white, bright smile. So removing the stain from the surfaces. And we want to provide our care and treatment and make it individual to our patients' needs and preferences. So we're going to talk about both rubber cup and air polishing techniques this evening. So when you think about a rubber cup or air polishing, what would be the difference between the two? Because we can remove biofilm and stain both with a rubber cup or with air polishing. So a rubber cup is more like if you think about sandpaper and then using the sandpaper to remove debris on the surface of something versus going through a car wash, which is more like erosion or more like the air polishing. So you're utilizing the air with polishing abrasives in it. And I like this photograph. So this is over 100 years ago, Dr. Phones, he started the first dental hygiene program. And in this photograph, it's showing you that he trained over 100 dental professionals so that they could provide care to patients. So there's no PPE in this picture. They're standing up as they provide care. And this became kind of our accepted treatment to patients. And the expectation that patients wanted was to come to the dentist and have their teeth polished. So a lot of times, from working in an office, when you're talking with a patient, what their number one priority is, they want white teeth. They either want to whiten their teeth or they want to have their teeth polished. And so that's really their big goal, is having their teeth polished. So we became very routine about polishing patients' teeth every time they came to a dental appointment. And we got into the habit of recommending having their teeth cleaned or polished every 6 months. And that became kind of the standard way we provided care and treatment. That was our routine polishing that we provided. And then in the early 2000s, an article was published, about talking about selective polishing. Patients are living longer now. It used to be people were very elderly in their 50s or 60s, and their life expectancy was quite a bit shorter than it is today. Now people are living well into their 80s, 90s, or even longer. So getting their teeth polished twice a year was thought to be maybe excessive, because if we're polishing their teeth that often, and maybe it's a patient who has periodontal disease, they're getting their teeth polished more frequently, it was thought that potentially we were causing excessive wearing away of the enamel surfaces for the patient. So then I was part of teaching selective polishing in the early 2000s. I started teaching at Portland Community College in 2001, and we were talking pretty heavily about selective polishing. I'm going to move on and talk about effective polishing parameters, but first we're going to look at selective polishing and where that information came from. So when we look at research, it was kind of summarized saying that if we polished people's teeth, twice a year, and we did this routinely, we could remove a substantial amount of enamel. But when we looked at this research information, we could see that clearly a lot of times in these research articles, they were using lab grade pumice, and we don't use lab grade pumice on human teeth. They were polishing the tooth for 30 seconds, which is a really long time to sit on one tooth and polish for 30 seconds. And they were using about 250 grams of pressure. So here's just a glimpse. Look at the top box, because we're just going to look at a glimpse of some of the articles. There were more articles that were used in this theory of selective polishing. And there were different parameters. For instance, they were using bovine teeth. They weren't using human teeth in many of the studies, and they were polishing again, as I said, for 30 seconds, which is a very long time per tooth. They were also using various RPMs, so there was really no standard. In fact, some handpieces could go clear up to 8,000 RPMs, which is a lot. And they were using varying amounts of pressure. So of course, if we're using lab grade pumice and polishing for that long of time, we are going to remove teeth. But then looking at a different article that was really important, they simulated in this research, they simulated 75 years of semi-annual polishing. So if you can imagine, this is, a child by the time they get their permanent teeth in their mouth. So this could be potentially an adult that was 85 years old. We're really probably polishing 5 seconds. And 5 seconds is actually quite long as well to spend on one tooth. If you think counting 1, 1,000, 2, 1,000, 3, 1,000. So counting in that manner, you want to polish, to the distal surface of the tooth, going around the distal buccal line angle. You want to do the cervical third of the tooth, and then the mesial, and then the facial surface, which is pretty generous amount of time, 5 seconds for one tooth. They used coarse Prophy paste in this particular study, and they used 150 grams of pressure and 2,500 RPMs, and they found that actually minimal amount of enamel is removed using those parameters. So looking at the research that's down below, That article was published in 1987. So this kind of contradicts what the recommendation was for select polishing. So with that information, we want to look more at our effective hygiene polishing. And there was a really important study done by Sandra Pence and Rella Christensen, and they did the simulated polishing, and they published this article in 2011 that said we are fine to polish patients' teeth every 6 months, but we want to really look a little bit deeper at what we're using, how we're using it, and why we're using it. So we want to base our polishing more on our patients' needs and preferences. So looking at the hand pieces, different hand pieces in the past, the one that's far to the right, that guy weighs probably, I'm going to guess about, I don't know, a couple of pounds. It's pretty heavy. And that's the handpiece that I used when I was in hygiene school. And believe it or not, I still see that handpiece in practice today. And that's pretty bulky. That can lead to clinician fatigue. Sometimes we can have wrist and hand and shoulder issues from polishing with equipment that's too heavy. So we want to look at the technology that we're using, and we want to use a handpiece like the one on the left that is circled. This was designed for a hygienist. So it's a corded handpiece. It's lightweight. It has a speed that's closer to about 3,000 RPM, so still above the recommendation, but you have plenty of speed there. And it also has a nice rotation feature where the angle sits next to the handpiece. So much kinder to the clinician using that particular kind of handpiece. It's a lot smaller, easier to handle. And then there are also cordless options. So this particular handpiece may feel like it's a little bit heavier than a corded. It's actually not. It's just the way that it's designed, but it's also not having to be bogged down by a cord. So for many dental assistants and hygienists, they love this particular handpiece because you literally have the freedom to not be held down by the cord. So you don't have as much fatigue. It eliminates that drag of the cord, so it makes it feel like it's a lot lighter feeling to you. It's also very quiet. Patients love the fact that it's very quiet. Often there's so much noise going on in the dental office that just taking one thing out of the equation, like a quiet handpiece, really brings that anxiety for the patient down a notch. And for us, of course, we always like having a little bit less noise because it can be quite noisy in a dental practice. But you don't want to be, you don't want to think that because there's not the noise, we don't have the power, because there is still plenty of power with these cordless handpieces. So with a cordless handpiece, this particular one, you can use a foot pedal or not. When you're not using a foot pedal, it's called smart mode. So if you are interested in looking at this kind of technology, I will give you my email address and my phone number. You can just reach out and we can bring one to your office, either myself or one of my coworkers. We can bring one and leave it at your office. You can try it for about a week, but there's some real benefits to it. So ergonomically, it's a much nicer piece of equipment for a clinician. It's quiet. It is both FDA approved and CDC compliant. So if you're not using the pedal, you will push the button that is on the handpiece and it will turn purple. It will start to idle so that you can pick up the Prophy paste. And then here's the charging base that it sits in. So this particular handpiece, it will idle at about 500 RPMs. So it gives you a chance to pick up that Prophy paste. And then as you contact the tooth and you start to apply pressure to it, the speed will ramp up. And that's how you get it to increase with speed. So when we're talking about the speed, really important to look at the abrasion or the excessive wear of the enamel or tooth surface. And the different things that affect it are speed, pressure, and the type of Prophy paste that you're using. So when we talk about Prophy paste, we want to be thinking about the shape of that abrasive particle, the size of it, and also the hardness of it. So not all Prophy pastes are alike. And we're going to take a little bit deeper dive into looking at Prophy paste. So as you increase the speed, you're going to increase the rate of abrasion. So having a handpiece that's designed just for polishing teeth, so using a slow motor handpiece designed for that purpose is ideal. And pressure, so not using any pressure on the tooth, so just being as gentle as possible as you can, because if it takes a lot of pressure to remove the stain off of a tooth, it's likely that that stain is actually embedded in calculus. So if you're using pretty abrasive polishing paste and pressure, even if it's embedded in calculus, you can probably still remove it. But that's not kind to the tooth surface. It's not a very practical way to provide care. So pressure is always a really important feature to keep in mind. So as we increase the pressure, as I said, we will increase that abrasion rate. We want to just have light to moderate intermittent pressure on the tooth, because a lot of pressure will also create heat in the tooth and make the patient uncomfortable as well. And now when we are using pressure, we want to think about what type of a Prophy cup or disposable Prophy angle are we using. If you're using a soft cup, it will flare out and go around the line angles of the tooth. It will flare out under the gingival margin. So you're going to have a more thorough polishing experience, and you're also going to make it much more comfortable for the patient, because that cup is flaring out much more easily if you're using a soft cup. Cups also come with an option of having some ribbing and webbing to them. That helps to retain the paste and minimizes the spatter, but also it helps to remove that stain and biofilm much more thoroughly from the tooth surface. And then when we're talking about the quantity of paste, every time I talk about the quantity of paste, when I talk about this particular topic with hygienists or dental assistants, it takes me back to hygiene school. And I have to admit, the very first patient I had that I polished their teeth, I used a lot of Prophy paste on that poor first patient. And I still have some guilt over it, because I have no idea what type of Prophy paste I was using. It could be that it was coarse Prophy paste. I used a lot of it, and it took me a long time. So my poor patient definitely had polished teeth, but I probably wore away more enamel than I really should have in that period of time that I polished their teeth. So we want to load up our cup, and then when we are ready to start polishing, we want to distribute it over the tooth surface so that you kind of like empty out that paste on the tooth surface. And then that way we're going to be causing less frictional heat as we're polishing. So evenly distribute it over the surface and then begin your polishing procedure. And it's always a really good idea if you have kind of a routine or a system in place. So usually what I do is I will usually distribute the paste, and then and this is my own preference, and you can do it however you like it, but I usually go to the distal surface. So I start from right in the center of the tooth, and I rotate over to the distal buccal surface, and then I do the mesial buccal, and then I do the facial down to the incisal edge. So if you have a routine, you'll be able to polish a lot more thoroughly and consistently. There are different kinds of polishing abrasives, and here is a list of different abrasives that are found in dentistry. So not all abrasive particles are the same. In fact, you might even look at toothpaste next time you go to the drugstore or the grocery store and you're looking at toothpaste. Sometimes toothpaste will have sodium bicarbonate in it. Sometimes it will have silica, and sometimes it will have alumina in it. So abrasive particles can be very different for our polishing agents. And not only are we looking at the type of abrasive particle, but also the shape. So the shape does matter. If you've got some that have sharp edges, that's going to increase the rate of abrasion of the tooth as well. And the size of the particle also matters. So if you have a larger particle, it's going to be more abrasive. And this is a really interesting fact about dental Prophy paste. There's no standardization of grit. I find this really interesting. So if you're using fine, it can be 0 to 10 micrometers. Medium can be anywhere from 10 to 100, and coarse can be 100 to 500. That is a huge range. And then there's also, believe it or not, a coarse plus. So we're going to look at Prophy paste and think about the hardness of the particle we're using, what we're selecting for our patient treatment. So important to look at the abrasive particles that you're using. We refer to Mohs hardness scale in dentistry a lot, where a number 1 is similar to talc powder, and a number 10 on Mohs hardness scale would be similar to diamonds. So sodium bicarbonate we can see is a 0.5, and calcium carbonate is even smaller than that. And so these are just different particles that are used. Enamel, we can see, has a Mohs hardness scale of about 5. And when we get on exposed root surfaces or dentin, we are 3 to about 4. So really important to keep in mind exposed root surfaces, because you can remove that surface a lot easier than you can enamel when you're polishing. So the harder the particles, the more abrasion is going to occur. So we want to flare that cup interproximally so that we're removing that biofilm completely. Often this is where patients also have stain is going around line angles, so areas that are more difficult to reach with their toothbrush as well. And when we look at angles, there's so many different angles to choose from. I really like this contra angle because ergonomically it's designed to be able to access all the areas in the mouth. And it gives you as the clinician, your hand and your wrist a much more favorable position. So you won't be having so much fatigue experience when you're polishing. So these are the different angles that are available. So we can see there are so many things in the marketplace available for you to select from. And so depending on your need, you might want to use a brush or a point. You might like webbing, or you might like kind of the ribbing on the outside, which I like that one quite a bit as well. And here's another example of the different Prophy angles that are available. The angles on the right are specifically for the new Pro Freedom, because it doesn't have the shaft that comes down that locks into the motor. So it's designed this way to have some retention when you're using it. But all the different cup designs and brushes that are available in both the typical disposable Prophy angles or in the Freedom disposable Prophy angles. So angle selection, important to look at. There's some really slim and more desirable Prophy angles to use. There's some that have pitot heads on them. Having a slender neck is another feature that I like, because sometimes you're out of room in the back of the patient's mouth. You can't really see. So if you're using a slim angle, you actually are able to see the tooth a little bit more clearly. And it makes it more ergonomical for you as a hygienist as well to reach those really difficult areas. So you can look at contra angles, you can look at soft or spiral angles. And if you're interested in trying out different angles, please just reach out to me. I'd be very happy to bring in some Prophy angles as well for you to try. So let's look at Prophy paste. So I happen to sell this particular brand of New Pro Prophy paste. This is gluten-free. I have people ask that question. It is gluten-free. And this product is manufactured in the United States, and it's color-coded for the different grits as well. So that's really handy. If you happen to have a lot of Prophy paste all in one location, you haven't separated, it will make it much easier for you to select the paste that you're looking for. So fine Prophy paste will be a gold colored top. Medium Prophy paste will have a blue color on the top. Coarse will be red, and then the plus is green. So we want to select our Prophy paste based on our patient's needs and preferences. When we are polishing teeth, one thing that's really important to remember is if you have a patient with a lot of stain on their teeth and coarse paste is what you've selected, think about if you're going to refinish some furniture, you might start by sanding off some of the defects or the debris that's on the piece of wood that you have with coarse sandpaper. And then you're going to step it down to more of a medium grit sandpaper. And then you're going to finish it with a very fine sandpaper so that you've got a nice smooth surface. Think about that when you're selecting your paste, because if you are using coarse, the recommendation is to step it down to medium and then finish it with fine. And the reason is, with coarse paste, you're actually going to put more scratches and grooves on that tooth surface. So if you have scratches and grooves present, you're going to attract much more biofilm and stain. So think about these poor patients that smoke. There are smokers' toothpaste in the marketplace. They are very abrasive. And these poor patients want to get the stain off their teeth. So they're using this abrasive toothpaste. Then they come to the dentist and we polish their teeth with coarse paste and send them away. And all we're doing is removing more enamel and creating more scratches on that tooth surface. So a really important thing is to remember to step it down, and that your final polish will be with a fine paste so that that patient will not get more biofilm adhering to the tooth surface and attract more stain. So important to think about the knowledge that's behind why we're polishing and what kinds of materials and equipment are we using. So there are also polishing agents that have therapeutic benefits. So we're going to look at a few of these now. So calcium phosphate technology, this is called ACP. This is very popular. There's ACP with CPP, and there's also calcium sodium phosphosilicates as well. And what all these products do is they occlude the dental tubules by forming a hydroxyapatite layer on the tooth so that it's giving the patient relief. It's that sensation that travels down the dental tubules to the pulp chamber, stimulates the nerve in the tooth that gives that sensitivity. So if we occlude the dental tubules, the patient's going to be much more comfortable. So we're going to look at the different products right now. So looking at CPP and CPP with ACP, these are casein phosphopeptides, is a dairy product. So if you have a patient who has a true dairy allergy, not lactose intolerant, but a true dairy allergy, you want to stay away from MI paste, because that actually is made with a casein product. And what this does is it binds and it stabilizes the ACP to the tooth with those casein phosphopeptides. And then it releases the ACP during an acid attack. So with MI paste, it's recommended that you apply it multiple times a day so that the patient has the benefit of having relief. So sometimes you can polish with this before you start your treatment with your patient. And then Nupro Extra Care, this is a fantastic product. GlaxoSmithKline owns a product that's called Novamin. And what Novamin does is it actually builds that hydroxyapatite layer on the tooth. And there are two published clinical studies. They are a double-blind, randomized, controlled trial associated with this paste as well. And so this is a fantastic Prophy paste. I sell a lot of this to periodontal practices, and it's really no wonder. It's made from a bioactive glass, and this is actually used a lot. Novamin is used a lot in bone regenerative therapy. So you can Google search Novamin and find that it's used quite a bit in medicine. In dentistry, the only place you can find it in the United States is in Nupro Extra Care paste. So this is a fantastic paste. It directly forms that hydroxyapatite layer on the tooth. So I'm going to give you a few different studies here to look at and compare. So the one on the upper left-hand corner, that's the product that we're using, Nupro Extra Care with Novamin. The one on the top row to the right, that's using a topical paste, CPP, ACP. And then when we drop to the second row, the product on the left is Prophy paste with ProArgin in it. And the one on the right is Prophy paste with ACP. All of these products are to provide relief from dentin hypersensitivity. So the very first image in all four of these examples is showing you the open tubules that a tooth has. And so you can see that that sensation will travel right down those tubules. They're just like little tunnels that run all the way to the pulp chamber. and they transmit that sensation of cold or touch or whatever is providing that hypersensitivity to the patient. Then the very next image to the right of the exposed dental tubules are surfaces that have been treated. So the first one on the upper left, that tooth was treated with Novamin, so polishing that tooth with Nupro Extra Care, waiting for a minute, and then rinse. And you can see how the dental tubules are still sealed. And then the next image shows you orange juice, and it's in red. We're still looking at Novamin, the set of studies that's to the upper left-hand corner. And even exposed to citric acid, which is orange juice, for about 5 minutes, there's basically no change. Then this study was taken one step further and exposed the tooth to Coca-Cola for 5 minutes to take that tooth to one more acid challenge, and the dental tubules still remain protected. Then when we look at the next study to the right, this is using topical paste with CPP ACP, so MI Paste Plus. We can see the open tubules in the first image. The second one, the tooth is polished, wait for 1 minute, and then rinse. And we can see some of that ACP is actually clinging on to those dental tubules. Then we expose this to orange juice, and we can see the dental tubules now are starting to open, expose it further to Coca-Cola, and the patient really is not having any protection from the environment after exposing it to both of the acid challenges it had. Then dropping down to the lower row with Pro-Argin paste, we can see we're having a very profound effect when we first polish, wait for a minute, and then rinse. And then the third image, it doesn't hold up to the orange juice challenge, or the next image, the Coca-Cola challenge. Moving on now to Prophy paste with just ACP alone, we can see the open dental tubules. We polish, wait for a minute, and then rinse. And there's basically dental tubules still remain open, very little effect going on there. And then after 5 minutes of orange juice, so citric acid, and then 5 minutes of Coca-Cola, the dental tubules are now exposed. So I just wanted to show you the microscopic slide so you could see microscopically what is happening. So this is a fantastic product, and it lasts for 4 weeks for the patient. If you happen to have a tooth that's hypersensitive, so if you need to protect your tooth when you're drinking something cold, or maybe you avoid eating ice cream, if you just take this particular product and just simply rub it on your teeth, you will not believe what a profound effect it will have on you and relieve you from that hypersensitivity. Again, this is gluten-free. It also is free of dyes and sodium lauryl sulfite as well. So this particular paste is white. So if you see a white paste and you're wondering what this is Nupro Extra Care. It will say Nupro on the top, and it has Novamin in it, so it's always purposely white. So again, this is just showing you the results that you get from using a Nupro Extra Care with Novamin in it. And now for patients that maybe have some restorations in their mouth that have lost their luster and shine. That can happen with older restorations. And this is a really cool product. So it comes in these little syringes. It's been around for a long time. I have a lot of people ask me, is this a new product? Well, I've been using it probably for 20 years as a hygienist, and it's such a cool product. So if you have some restorations that have lost their luster, this particular product is a microfine alumina oxide paste, and it will restore the luster. So you just take a little bit out of this syringe. So typically a patient won't have every single tooth in their mouth restored. So just take a look at their mouth. If they have 1 tooth or 4 or 5, it's going to tell you how much paste you need. It doesn't take a lot. And then you just polish them the same way that you would normally their teeth with polishing paste. So it's fantastic for putting that luster back on those kind of dulled restorations. And so you can also use it on prosthetics as well. So sometimes this can start to look a little bit dull, but it's a great product to use. With a patient who presents with this type of a condition with these prosthetic and abutment surfaces in the patient's mouth. We really want to use only fine paste on here because you'll leave a lot of scratches that will be visible. And we want to make sure we take really good care of the patient's dentistry because they put a lot of time and a lot of money into this type of dental work. So let's take a look at what shimmer can do. So in the upper left-hand corner, we have a microscopic view of an untreated tooth surface. When we drop down using fine Prophy paste, here we can see we've left scratches even with fine. And then on the upper right-hand side, this is a clay-based paste. So the scratches are even deeper than that. So if you have a tooth like that and you use shimmer on it, you can restore it back to that, looking very similar to that untreated surface. So it's a great product to use. And so just remember what we talked about with scratches. So if we have scratches or irregular surfaces on the teeth and we're using coarse paste, we want to step it down next to medium and then finish with a fine so that we leave the patient with a tooth surface that's going to stand up and hold up and be a little more resistant to attracting biofilm and stain both. So one size grit isn't standard for every patient. And I know that often that's common in dental offices. So sometimes going back and revisiting what you learned in school and why are we polishing and what are the products we're using, really, really important to make sure that we're selecting the correct polish for that particular situation. Now I'm going to move on to air polishing. So looking at air polishing and rubber cup, I really like air polishing a lot. It's less abrasive. So again, it's like the car wash, going through the car wash and using that kind of slurry that's formed between the powder and the water. So you're polishing the tooth in a non-contact fashion. Doesn't generate any heat at all. It can be very, very quick. I find that I can polish somebody's teeth using an air polishing system in less than half the time of a rubber cup. So there are different abrasive particles available that we use for air polishing. So some particles are not meant to be used coronal, they're meant to be only used subgingival. If you're using some that are for subgingival use only, like calcium carbonate, it's very small, and then you can wind up with powder all over the operatory, excuse me, not calcium carbonate, but the glycine powder is very, very small. Sodium bicarbonate is a really popular product to use. And then there's aluminum trihydroxide, calcium carbonate, and then glycine powder. So these are the different polishing powders available for air polishing. These are both of these type of equipment here. The Cavitron Prophy Jet air polisher is on the left, and on the right is the Cavitron Jet Plus, which is a scaler, combination scaler and air polishing both. With these devices, these are intended to be used for supra, so above the gum line only. And then there are different types of equipment that are used for subgingival air polishing. So the advantages is we can remove 100% of the bacteria and endotoxins from the tooth, and it's a much more comfortable procedure for the patient. We can use it on implants. It doesn't generate any teeth. It creates a very uniformly smooth root surface, and we're not touching the tooth at all, so there's no pressure, there's no contact. There's a greater access for stain removal in the pits and the fissures. We're going to look at that when we are talking about placing sealants. So it's less abrasive and then can reduce operator fatigue because it's a lot quicker procedure for the clinician. So it's fantastic. Great for before you place sealants or before a patient has orthodontic treatment as well. The studies are great for both of those using air polishing. And we're able to remove the stain. So it's simply just like you're just kind of blowing it off of the tooth. It's such a great device to use. So let's look at periodontal treatment. On these exposed root surfaces, we always want to be really, really careful. So I was very happy to be using an air polisher for patients who had exposed root surfaces like this. So using sodium bicarbonate on it, which is completely water soluble, is not going to be removing tooth surface for the patient. And it will be getting off all the stain, because if you have a patient who has exposed root surfaces like this, they can attract a lot more stain on those root surfaces than on the crowns. And for periodontal patients, we can disrupt that bacterial colonization. So we can destroy the fibroblast attachment there, detoxification. We won't be, excuse me, altering the surface at all when we're doing it. So it's fantastic for patients with peri-implantitis. So when we air polish implants, we want to be very careful in our approach. I'm going to show you how we approach those teeth, but there are plenty of research articles, literally hundreds of them, that show how effective it is in removing biofilm. So we want to make sure that we're removing biofilm as thoroughly as possible on implant teeth, because these implants are affected by the same type of bacteria and destruction that happens on natural teeth, but at a much higher rate because of the way the periodontal ligaments attach to the implants. So it can be more efficient than a rubber cut polishing, as I said, much more effectively, a lot faster. We can get around these brackets, which are great. They're a nightmare to polish around. And we can get the tooth ready before you actually place the brackets on there. You're going to have a much greater adherence to the tooth surface if you can use the Prophy Jet before the brackets are placed. For sealants, there's a lot of research on dental sealants. So you'll have a much deeper and greater penetration of the sealant material into those deep pits and fissures if you can Prophy Jet those occlusal surfaces before placing a sealant. It's highly recommended because it improves the bond strength of the sealant to the tooth. Now, taking a look at this patient, we want to make sure that we can provide the best care we possibly can. Now, I want you to see that that tissue is already inflamed around there. So we know this patient has some gingival inflammation going on. But this is what you can do with a Prophy Jet, and you can do it very quickly. And you can also see that the tissue is a little bit inflamed there. If you look at the image on the top, this would have been expected. And then this is probably what you see more routinely is patients presenting with stain like this. And then this is how you can finish using the Prophy Jet. So it's a very quick procedure. So looking at the different particles, excuse me, that are out there, I'm a big fan of sodium bicarbonate because it was actually the first powder abrasive that was used in dentistry. It is food grade. It has a scant amounts of calcium, phosphate, and silica in it. So when we look at the Mohs hardness scale, pumice is about a 6 on that scale. And remember, our tooth is 5, dentin is 3 to 4, and then sodium bicarbonate is a 2.5. So sodium bicarbonate is safe on enamel. It's water soluble. It's a great product to use, but we want to be careful if our patients are on a restricted diet because it is sodium bicarbonate. And then if they have denuded root surfaces, we want to steer clear of those. We want to steer clear of those with really any product on there. And then we want to be careful around our composite and porcelain veneers as well. And we don't want to remove that beautiful finish that they have on those porcelain veneers. And if you have a patient that is on a sodium restricted diet, this Jet Fresh paste is aluminum trihydroxide. This is the other option to use. It's not water soluble. However, on a Mohs hardness scale, it is about a 2.5. And then when we are polishing a tooth, this is the angulation that we want to have on our buccal surfaces. It's going to be about a 60-degree angle. So you're going to be aiming right about the middle third of the tooth. You don't want to get down right close to the gingival margin because it is a steady stream of air, water, and our abrasive particles. So we can cause some trauma if we get really close to the gingival margin. And then for the posterior teeth, we're going to be at about an 80-degree angle because of the tooth shape changes. And then on the right side, this is if you're going to be placing a sealant, you go right at 90 degrees to that occlusal surface so that you can prepare that tooth for a sealant. So our bottom line is we can do our essential selective polishing. We want to determine what our patient's polishing needs and preferences are before we select our agent. So looking at our Prophy paste or cleaning agent, and then also consider your air polishing agent as well. So sometimes people say, well, with all that polishing, what are we doing to that fluoride-rich surface that we have in the enamel? Well, you know what? As soon as your patient starts to salivate and that tooth is being bathed in saliva, it's being remineralized immediately. But what we can do for our patients is we can provide them with a fluoride varnish treatment. In the Portland area, we unfortunately do not have fluoridated water, which I know some of you probably are in favor of and some are not. But you can't dispute the research and the evidence that's there about fluoride. And we do live in a very high decay rate city when you compare Portland to some other cities in the United States that are fluoridated. So the need for fluoride varnish is definitely there for patients of all ages. It is approved for dentin hypersensitivity in adults. And also we know it has a definite caries benefit as well. So it's very easy to use this particular fluoride varnish. You don't need a dry tooth. The research shows that we have a much higher uptake to the tooth surface with NuPro white varnish over other brands. And this is just showing you an example of some of the other brands that this was tested against. So this is a great varnish. You don't have to dry the tooth surface. You just simply put the brush into the varnish, stir it up a little bit because some separation does occur in almost every product in the marketplace. And then just do one swipe across the buccal, stir it again, a swipe across the lingual, and the patient's good to go. It's a really good idea to not give the patient the saliva ejectors to spit into, because fluoride varnish can get down in there and kind of gum up your suction lines. So if your patient does feel like they need to spit out, give them a paper cup or send them to the sink instead of putting it down into your suction lines. So now protecting yourself and your patients, really important to consider this when you're providing care to your patients. So having the correct masks, we have all become mask experts, but we want to choose the correct mask based on our procedures. So we know that there are ASTM level 1, 2, and 3. So important to look at the box when you're selecting a mask. If you do not have an ASTM rating on the box, then that means that those masks do not meet standard requirements. So I would avoid purchasing masks that do not have an ASTM level rating on them. So this is to protect you, the clinician. So ASTM level 1, this is a mask that could be great for just cleaning up your operatory or processing instruments. Using ASTM level 2 will be while you're providing treatment care to a patient. And then ASTM level 3 would be anytime you have an aerosol procedure with a patient. So then you would want to select an ASTM level 3 mask. Really, really important when you're putting your mask on to remember that when we wear our clothes, like when you're putting your jeans or your top on, we tend to put our seams on the inside so they're not showing. But with a mask, you actually want the seams on the outside so that mask can lay flat against your face. That way you have a nice seal with that mask against your face. If you do a little twist in those ear loops before you put them on, so you're creating a little vent so that you can breathe better, you're actually creating a pathway for those pathogens to enter as well, so you'll be breathing them. That's not a good practice to have. You want to make sure that you have that mask laying flat against your face. And when you take the mask off, really important to remove it from the ear loops, because that's the most contaminated bit of PPE that you're wearing, is that face mask. It should only be worn for one patient procedure. It's not a good idea to take it off and put it into your pocket or hang it on a cabinet doorknob. Also, we want to make sure we are covering our nose, because that's how the pathogens enter your body, is through your mouth, your nose. So you want to make sure you've got your your mouth and your nose both protected with that face mask, how it's intended to be worn. So looking at your mask is really important. This is a great mask that has kind of an elastic chin on it. It's very soft. It fits flat against your face. You can see in this study up here how this clinician has eyewear and then a face mask on so that they're fully protected wearing that face mask. And then also using high volume evacuation. If you're using an air polisher, highly recommend that you're using your HVE, the high volume evacuation. Hygienists are slow to come to the table because they don't generally practice with a dental assistant, but I don't think a dentist would ever provide care and treatment without using high volume evacuation. They have a dental assistant that sits right there and does the suctioning for them. What we're trying to do is capture that aerosol before it escapes into the room. So high volume evacuation has been recommended by the American Dental Association, the CDC. It's been a recommendation actually since the early 2000s. Now, if you have products that have a number 2 and a slash through it, this means that you don't want to use it a second time. So when we're looking at our disposable Prophy angles, they will have, oh, I must have hid that slide. They are single-use disposable items only. You cannot use them, put them in a cold liquid disinfectant. They should be thrown away when you're finished with your patient. The same way goes for any articles that have a 2 and a slash on them. They are intended for disposable use only. They cannot tolerate heat. So these are great because it reduces the risk of exposure to the patient. So highly recommended to move to single-use disposable items. While we're talking about this single-use disposable items, I just want to share an article with you about metal air water syringe tips. This was a study that was published in Dental Advisor. So you can actually pull this up online and read it for yourself. And you can see that metal air water syringes, often when they go through sterilization, they're actually not sterile because the lumen in the center is so small, it cannot actually ever get sterilized. And if they start to have a little bit of corrosion on the outside or pitting on the outside, you can be 100% sure that that's happening on the internal components as well. So you're going to have a lot more debris and contamination in there. So moving to a safer disposable item would be using an air water syringe that is disposable. Lots of different air water syringes on the marketplace. They're not all the same. You want to look for one that has both a separate air and water channel so that you minimize that air and water crossover. There's nothing worse than getting all set to place a sealant. You've got a nice dry tooth and you're drying it a little bit more and all of a sudden you see some water contamination on it. So looking for a high quality air water syringe tip is really important. You want it to be strong enough that you can actually retract the cheek as well. You want it to be have a smooth rounded tip on it so it's comfortable for the patient. Now, how do we take care of our equipment? Because dental equipment is expensive. We want to protect our investment is what we're going to talk about next. So when we are talking about using dental equipment, we really want to go back and look at what the CDC says. So for handpieces, we want to make sure that we are heat sterilizing a handpiece after every single patient. So for every patient, any handpiece, whether it's high speed or low speed, we need to be heat sterilizing them. There are so many studies that support this. Like the worst study was done that found that from one patient to the next, it had about a 93% chance of pathogens being sucked down into the motor. And then the best case would be when it was 53%. But if you're using that again on another patient and then another patient all day long and day after day, all week long, this is not acceptable. There's so much research and so much information out there that we really want to look at the experts and we want to look at what the scientific evidence tells us. And it tells us that sterilization is the only way we can destroy that those pathogens and the spores that can occur in the internal components of a handpiece. We don't want to just simply wipe them down and use them on another patient. CDC has this book, which you can download online, or you can write to them and you can order it online, or you can just print it, download it, and keep it in your office. It's a great guide to go back to and just visit. This one's just a summary. It's from 2016. You can also get the whole CDC document from 2003, but it's about 144 pages. You can download that and put that into your office. But this one is great for just going through to see if we are in compliance and we're doing the correct thing. But in here, they clearly spell out how we should be heat sterilizing handpieces after every single patient. So follow the directions for use. It is repeated over and over and over again. It's actually in our Oregon Board of Dentistry regulations as well. So what we do for our infection control is we adopt the CDC recommendations, and those become our regulations for the state of Oregon. The FDA says costs can no longer be an excuse for non-compliance. If we are using a handpiece that's not FDA approved, we really want to consider what type of equipment we're using, because what the FDA does is they look at safety and efficacy, and they have not approved a handpiece since 2001 that could not tolerate heat sterilization. ADA has also posted that we want to make sure that we are heat sterilizing our handpieces after each patient. And then JADA has also published this information. So it's very well known and very well published that we want to make sure we have 3 corded handpieces at minimum for our clinician. So we've got 1 to use on the patient, 1 in the sterilizer, and 1 in the drawer for the next patient. Or if you're using a cordless handpiece like the new Pro Freedom, this handpiece does not get heat sterilized, but it is CDC approved and FDA compliant as well. And it comes with 3 sheaths. So the same thought is 1 for the patient you're treating, 1 in the sterilizer, 1 in the drawer for the next patient. And the rule applies to Cavitron SteriMate handpieces as well, is these should be heat sterilized. We want to move away from just disinfecting equipment that is can be heat sterilized. So with this particular handpiece, we're going to throw away that Prophy angle when it comes off. We're going to take that metal sheath off, and we're going to heat sterilize that. And then we're going to disinfect wipe the motor portion of this cordless handpiece. So be careful that you don't use disinfectant wipes on the sheath. We can use a wet towel or a brush, or run it underneath water to clean off any debris from the external components. And then we will bag it and get ready to place it into the sterilizer. One really important thing to remember about sterilizers are, it's important that when equipment goes into the sterilizer, it should be dry, because for FDA approval, all these sterilizers in the marketplace have all gone through the same type of testing. And when they have been approved for the marketplace, they don't account for any moisture on there. So sometimes people say, well, stuff's going to get wet in there anyway. We want to make sure our equipment goes in there dry. So we want to clean it, dry it, and then put it into the sterilizer. Once you start that sterilizer, you want it to run through the dry cycle as well. Complete that whole entire cycle, and not just wait until it says it's sterilized. Now we are in the dry cycle. In order to be in compliance with the recommendations from that particular manufacturer for that sterilizer, it should go through the entire dry cycle as well. And then for our sterilization instructions always come with every handpiece. This one is for the cordless handpiece, and then this is for the corded handpiece. Important to maintain it so that you don't void the warranty on it, and so your equipment can last you a very long time. So you want to clean and lube it the way that it is recommended according to the directions for use. So reprocess your equipment how it is intended to be reprocessed, including removing from the handpiece cable your SteriMate handpieces. They should also go into the sterilizer. Important that the sheath on the new Pro Freedom and that this SteriMate handpiece, neither of those should go into the ultrasonic bath. They should just be cleaned manually, or if you have an automated washer disinfector, that's fine. And then they should go through the sterilizer. And this is showing you the automated washer disinfector. So again, we want to be in compliance. And remember, 1 in use, 1 in the drawer, and then 1 in processing. So looking at our disinfectant wipes, this is Oxivir 1, has a 1-minute kill time. With the EPA, it's non-rated, which means it's considered non-toxic. However, we still want to wear gloves when we're handling disinfectant wipes, but important that it does have a 1-minute kill time. So I think we're running a little bit, maybe I'm doing okay. I tend to be a fast talker. I was getting a little bit behind here. So our key takeaways from today is really look at the care you're providing to the patient. Look at what the product that you're using and ask yourself, why am I selecting this particular product? We want to think about protecting ourselves and our patients, infection prevention, looking at the technology, including the maintenance of that technology as well. And if you have any questions at all, please feel free. You can text me or you can email me. So I've got my email here at the bottom of this slide and also my phone number. I would be happy to come to your office and give you samples of anything that you would like to try, or if you have any equipment that you would like to demo, I'd be happy to provide that as well. Also, I provide a lot of lunch and learn. So if you're interested in a lunch and learn for your office, please give me a call. These are the resources that were used for, actually, these aren't the resources, but these are video resources for you. There are lots and lots of videos available. If you go to YouTube and then the next thing is put in Dentsply, and you can find lots and lots of videos. And there are also a lot of CE courses that are free to you online as well through Dentsply Sirona website. So that is the end of the presentation. And I just want to thank you very much for attending.
Well, thank you so much, Monica. We really appreciate that. Was excellent. I learned a lot. Thank you. It was great.
A little fast there.
It was very, very good. And I thank you for providing that information for us. And we look forward to having you in a couple weeks come back and talk to us about radiology. It's great.
Fantastic. I look
Does
forward
anybody have any questions for Monica, or should we just go ahead and hopefully you've written down her information? And so if you want to contact her for any of those, yeah, there it is. And we'll have that available as well.
I would just like to also say thank you, Monica. You just did an excellent presentation. There was so much information.
Yeah.
And I'm thinking, oh, I wish the hygienist was on this. And I will be sure to share with the information.
Yeah. And I taught dental hygiene students, and I still meet with hygienists. And then I'm like, what were you taught about polishing in hygiene school? And they honestly, nobody's intending to do anything the wrong way. You just forget. It's like drinking from a fire hydrant, you know, when you go through school. And then they get into a practice and they use what's in the drawer without thinking,
exactly.
What am I using? You know, nobody intends to cause any harm.
Well, and there's so many new products. That's what's exciting.
Yes. Yes.
Well, thank you so much.
You're welcome.
Yeah, we really
Thank you for the
appreciate it.
invitation. I appreciate the invitation.
Well, thanks. Okay,
Yeah.
we'll be talking to you soon. It looks like, was there something in the chat? Oh, a thank you.
Okay.
All right.
All right.
Well, thanks so
so
much. And we will
Okay.
see you again. Thanks everybody for joining this evening. And if you have any questions for us, let us know. You can always go through the ODAA website as well and contact us that way. All right.
Have a nice
Okay.
evening.
Good night, everybody.
Bye-bye.